Old versus new understanding of pain. In the 1600s, a French philosopher named René Descartes came up with his theory of pain. He illustrated it with the example of a boy putting his foot in a fire. What Descartes said was that the fire pulled on a rope that was connected to a bell in the pain centre of the brain. And when the boy put his foot in the fire, it pulled on this rope, which rang the bell. In Descartes' model, the amount of pain is directly related to the amount of tissue damage. In the 1600s, this was pretty cutting edge stuff. However, there are a few holes in this theory. It doesn't explain why some shark attack victims have limbs bitten off but feel no pain at all whilst it's happening. It doesn't explain phantom limb pain. Some people who have lost a limb in an accident, for example, can still feel pain from that limb despite them not even having one. Over the last 50 years, we have learnt a great deal more about pain science and the mechanisms that underpin a pain experience. But despite this knowledge, back pain is still commonly described from the perspective of Descartes' model. You have pain because of your disc, or your ligament or your muscle, and the worse it is, the more pain you feel. This can be true, but it's not the whole story. For the whole story, we need a greater understanding of modern pain science and the neurobiology of why we feel pain. This will help to explain, for example, why some people with a disc or muscle injury can be out of pain in a couple of months, but other people are still in pain years later. So what is this newer, updated theory of why we feel pain? Prominent pain researcher Lorimer Moseley came up with this definition in 2003. Pain is an output of the brain that is produced whenever the brain concludes that body tissue is in danger and action is required. So this kind of switches Descartes' model upside down. Rather than pain being an input to the brain, pain is an output of the brain, and other factors other than tissue damage are involved in this experience. These factors include our beliefs around what is happening, our expectation, our prior experiences, our mood such as anxiety or depression, stress. All of those factors influence the volume and intensity of the pain response. Now, it's important to emphasise here, this does not mean pain is in your head. It isn't. What it means is that when we feel pain, the brain and the body work together to produce our experience of pain.